A hearty good afternoon and welcome to the session on what can be done if you are infertile. We are glad to have Dr. Sita Sharma among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Good afternoon, viewers. I'm Dr. Sita Sharma, Senior Consultant, Apollo Fertility, Amritsar. Today, I will take a very basic topic: what to do next. Once you found yourself, you are not able to conceive, or you found yourself, you are suffering from infertility. So I have chosen this topic because most of the patients, they are not cleared about their problem, what are, and there are many misconceptions also. So let's start with what is infertility. Infertility hota kya hai? Infertility is inability of a couple to conceive if they are trying for at least 1 year without using any kind of contraception. If they are staying together, they are having regular sexual contact without using contraception for 1 year, and if the age of the woman is more than 35, we take this period as 6 months. So this is infertility. And that is the time a couple should visit the doctor. Now fertility expert, they should go to some doctor who is expert in the field of infertility and its treatment, and they should freely, without any hesitation, talk about their problems to the doctor. So infertility is not only a female problem, there can be problems in the male as well, and there can be some problems in the couple as well. In 40% of the cases, the female is the cause lies within the female body. 30 to 40% cases, the male can be the cause factor for not conceiving, and there can be around 10 to 20% cases, both can have small little bit problems, they which are leading the couple is not able to conceive. So the couple should visit the doctor as soon as now they have acknowledged and they have found that they are not able to conceive with the regular trying, and they are not able to conceive with some help, but now it is time to visit your doctor. So once the couple comes to us, what we do and what should be done, that is the motive of today's Facebook live session. So when the couple comes to us, first of all we take their history, where proper history of the female, of the male partner history. If I start with the male partner, then I would always ask about any medical problem he is suffering from, like the importance of diabetes, importance of thyroid problem, importance of hypertension. If any of the medical problem the husband is having, they should be treated, because in diabetes, if diabetes will cause defect in the spermatogenesis, there is a low sperm count. And if the patient is suffering from, if it is found that husband is having thyroid problem which is not treated, or hypertension which is not treated, so all these problems can have effect on the sperm count. A normal semen count, a report we do in husband is semen report. The semen count should be more than 16 million per ml, and should be more than 40% of the motile sperms with more than 4% of the normal forms, that is morphology should be more than 4%. If this semen report is okay, then it is fine. If the husband is suffering from any problem like these problems, hypertension, diabetes, thyroid, any other medical illness, even tuberculosis, even some kind of viral infections in the recent past or in the childhood, if there is any history of any surgery done on the genital region, or any history of any having trauma, any history of undescended testes which has been operated in the childhood. So all kind of history is taken in the male partner, any history during the physical contact, if there is any problem in the ejaculation, problem in the erection, so all these things we ask the male partner, we examine the male partner. Then in the history, we then after examining and taking history from the male partner, then we go to the female, ask the any everything about the female partner, since how long we are staying together. And most of the time during the history, the couple reveals that they are married for 5 years, but they are staying only for you can say 1 year for the last time. And but they, what happens, if sometimes the husband is working somewhere, the husband is in abroad, he visits India only 2 to 3 months per year, or husband is in army, or husband is working outside the native place. So the then the physical contact during that ovulatory period is missed, so that may be the cause of infertility. So we have to reveal the history in very elaborate manner, and then we come to know where is the cause for infertility. It is not that every patient who is visiting the doctor is for IVF. We have to reveal the patient, we have to counsel the patient, and this factor is missing, you should try during this period. So most of the time we come to know that the couple has not tried during the specific period, because they are not able to be together during that phase because of the husband is working somewhere. So these things are very important. And the peer pressure or the family pressure on the woman is that, look, she is married for 5 years and not able to conceive. So we have to counsel the patient that this is the reason you are not conceiving. That is the importance of the history. Then apart from the history, then there is, if there is any problem of any infections in the female, like with long term vaginal discharge, pain during intercourse, or off and on bleeding from the vaginal tract, and any history of problem with the menstrual cycle, if she is getting regular periods, if she is getting irregular periods, if the cycles are missed for 2 to 3 months, or there is abnormal hair growth on the chin, or abnormal weight gain, even a weight loss also is very important. Then apart from this history, we ask about any medical problem the woman is suffering from, like if she is having diabetes, hypertension, any thyroid problem, prolactin, hyperprolactinemia, or sometimes the patient can have breast nipple discharge from the breast, milky discharge from the breast, or milk discharge from the breast. That is a sign of hyperprolactinemia that can also lead to infertility. And about the amount of the bleeding and periods, the woman can be suffering from PCOD if she is having weight gain, irregular periods, or there is abnormal growth on the abnormal growth of hairs on the face, or there is acne, there is discoloration, black discoloration on the back of the neck. So all these symptoms can be due to PCOD. And if the woman is young and she has stopped getting regular periods, she may be a candidate for a premature ovarian failure. So all these things we elaborately take the history and we counsel the patient accordingly. And another important thing which I have seen in my practice during these is the lifestyle problems. Our lifestyle is getting very worse during like youngsters are involved in very bad food habits, like they are taking lots of fast food, junk food. So there is intake of trans fats, etc., that and excessive carbohydrates, which leads to excessive weight gain, and then smoking, then even drugs intake, and then alcoholism. All these problems are leading to, they are increasing day by day, and that is why infertility is also increasing. Alcoholism, in case of males, when they are going to gym, they are taking some kind of anabolic steroids for bodybuilding. So all these factors are increasing the male infertility, out of which stress at workplace and stress due to many other factors is also very important cause. If you are not having a good sleep, if you are not having good diet, so all these kind of a stress on the body, so the reactive oxygen species are increasing, and that are becoming the cause of infertility, especially the male infertility. The sperm count is going down, the quality of the sperm is going down, morphology of the sperm is going down. So that is why the male infertility is increasing. So lifestyle modification is very, very important. You should maintain your ideal weight. Obesity is also a big problem in males as well as females. In males, it is causing the defect in the spermatogenesis, and normal sperm defect is there, and in the females it is causing problem in the ovulation. So maintenance of ideal weight is very, very important. So once you come to the doctor, these all problems are discussed from ABC root level to the higher level. We will come stepwise to that place. So in the male, semen examination is done. Apart from checking your BP, your blood pressure, your pulse rate and everything, and then we come to, in the male partner, we go for first investigation is the semen investigation, apart from the blood investigation like thyroid, sugar, viral markers, your CBC count, etc. And in the female, we go to the transvaginal scan. We always do a basic scan. First of all, basic examination, we examine the female from inside to know about the condition of the uterus, cervix, any kind of infection is there, any kind of polyp or growth is there. Once we take the female for ultrasound, we like to know all the female parts are functioning well, or if they are not having any kind of the disease. So this is a rough, this is a diagram to show the female parts. This is vagina, and this is the mouth of the uterus. We call it as cervix. This is the uterus, and these are fallopian tubes, and this is ovary. These are two ovaries. So female body has two ovaries, one uterus in the center and fallopian tubes. So once we do the scan, we always see this vagina. Vagina is normal. Then we see the cervix. Cervix should not have any polyp or any growth or any Nabatean follicles and any cyst, small cyst. And then we see the uterus. Uterus should be normal in shape and size. And then we cannot see the fallopian tubes on the ultrasound. We can see the ovaries. Normal ovary is seen as a ovary should be seen in the normal size, and ovary should be having small follicles. Follicles are the small sacs which have eggs in it. So when we do the follicular study to know whether a woman is ovulating or not, we are actually following the follicle. So the woman should have normal genital tract. Genital tract means normal uterus, normal cervix, normal vagina, and both fallopian tubes are normal, both ovaries are normal. So at that scan, we also see if the woman is suffering from some kind of problems, like there can be a small polyp inside the uterus. This is a small growth inside the uterus, or there can be a fibroid. Fibroid is a solid growth inside the wall of the uterus, or there can be ovary can have small cyst. Cyst can be a functional cyst, or cyst can be chocolate cyst. Chocolate cysts are a part of the disease known as endometriosis. So this is a basic idea about, and we get the idea about the antral follicular count in that female. Antral follicle count is the number of the follicles which are present in the ovaries at day 2 of the cycle. We usually do the scan. So that means these follicles are available for further cycles or further treatment. We can use those follicles, or we can advise the patient accordingly that your number of follicles present in your ovary is good. That means your antral follicle count is good, your fertility potential is good. So there are some basic tests which are done on the female body after that. One of the important tests is AMH. AMH is anti-Mullerian hormone. Anti-Mullerian hormone, if it is less than 1.5 actually, but if it is less than 1, it is considered as critical. You can say it is your follicular count is going down. AMH is directly proportional to the antral follicular count. Antral follicular count means जो आपके ovaries के अंदर follicles बचे हैं which are available for further cycles for reproduction. So अगर किसी का AMH count बहुत कम आ गया है, तो that means you have very less time to conceive. So now we should be alert. We should do something. We should save your ova for further fertility. And if the count is more than 8, then you can be a candidate of having PCOD. Your LH level can be very high. So AMH level is normal amount 1.5 to 3.5 we consider as normal values. Above that it is high responders, or it can be a candidate of high androgens or a high PCOD patient. So AMH is very important. Then other important tests are your second day, on the day 2 of the cycle we go for FSH, LH, and apart from this we go for thyroid. Your thyroid level TSH should be around 2.5, and we do anti-TPO also in some patients. Serum prolactin test is very important. Apart from this, your sugar level, then your viral markers, your blood group, and certain infections, we always do test those infections. So apart from, now we are done with the history and examination, we have come to know that this patient is suffering from this. So we will counsel the patient accordingly what kind of treatment she is needing. Some patients will need surgery. Surgery is indicated in some patients, like if there is any growth inside the uterus, we call it as polyp. So we have to remove the polyp. We will do hysteroscopy and we will remove the polyp. And if any fibroid is there who is touching the endometrial cavity, endometrium is the innermost layer of the uterus on which the baby implants. The implantation takes place on the endometrium, which is very important layer of the uterus. So any fibroid which is present in the wall of the uterus, but it is indenting the endometrium, so that fibroid we will need to be removed. We will be needing its surgery before we ask the patient to conceive, or before we go for any procedure like IUI or IVF. And if there is endometriosis or chocolate cyst in the ovary, and the size of the cyst is more than 4 centimeter, and the patient is having intense pain during periods and during sexual relations, and patient is not able to conceive because of this, and infertility of long period is there, then there this is also an indication for surgery. If the fibroid is less than 4 centimeter and it is not touching the uterine wall, or it is outside the uterine wall, it is growing towards away from the uterine cavity, and the chocolate cyst is there but it is not causing any problem to the patient, like not having any pain during periods or pain during relations, that may not be needing surgery immediately. So we do not do surgery in those cases, rather we try to make the patient pregnant so that she should conceive, because endometriosis is a problem in which the follicular count goes down steeply. AMH level become low very with the coming years, so that our aim is to make the patient pregnant as early as she can. So next, if we can do surgery in cases of fibroids, in case of cyst, in case of polyps, or in cases of endometriosis. Now what? Now we advise you that what about the fertile period? Fertile period is a period of the menstrual cycle in which the follicle grows in size, and one particular day the follicle gets ruptured. That is the time of ovulation. So that is the time, roughly it is from 10th day of the cycle to 20th of the day of the cycle. You can have relations on alternative day, and if you want to become very sure, and if we want to do your scan for ovulation study, then we can go for follicular monitoring. We monitor the follicle usually from 9th 10th day of the cycle we start, and then we follow the follicle on daily or alternative days transvaginal scan, and once the follicle reaches that particular size, then we advise the couple to have relations. And after that, after 2 days, we see the follicle has ruptured and there is a fluid in the pouch of Douglas, and the endometrium of the uterus is also grown well. So we advise the couple to have timed relations and during that period, and then they can conceive. One couple, the couple who is trying for conception, in the first month or in 1 month there are 6 to 8% chances of conception. If you try for 6 months, there can be 50% chance of you are being pregnant. And if you have tried for 1 year without using any kind of contraception, and you have tried during the fertile period, there are chances that 80% of the couples will conceive. So 10 to 20% of the couples will not conceive, and they will be needing further help. So the first assisted reproduction technique which patients are needing is IUI, intrauterine insemination. Intrauterine insemination is the basic technique in assisted reproduction. Where what we do, we give the couple ovulation inducing drugs, and then we follow the follicle. We on daily ultrasound, we see the follicle is maturing, and one fine day we give the injection trigger, and we take we decide that day, on this day we will do IUI, and husband semen is taken, and our embryologist will prepare the semen preparation is done, that is called semen processing, and healthy motile sperms are taken, and at the time of when just before ovulation, just before the rupture of the follicle, we take a small cannula with the motile sperms, and then it is injected just above the internal os, that is in the uterine cavity, so that the sperms reach the egg early. So this is a kind of assisted reproduction technique, basic technique or first level technique. It will be beneficial for the patients who are having some kind of male infertility, that is there is mild to moderate male infertility. The normal count, as I told you, is 16 million per ml, but in these cases it can be 6 to 10 millions per ml. So if there is mild to moderate degree of male infertility, then this technique can be beneficial for you. And the only requirement in this is female should be ovulating and tubes should be open. At least one tube should be open. IUI is beneficial in patients who are having less than 35 years of age, who is having regular cycles, there is no ovulatory defect, and at least one tube should be opened, and mild to moderate degree of semen problem, it is quite helpful in those cases. So this is a IUI. Then how will we check the tubes? The tubes are the seen tested. Normal tubes are not seen on the ultrasound. We can see the tubes by doing specialized test which are done after the periods. Once you are over with the periods, we do what we do. This is done by hysterosalpingography, which is done with the help of radiographin dye and X-ray. The dye is injected from below inside the uterus, and this dye then will fill the uterine cavity, and then it will come out through the tubes. Once it comes out through the tubes, it will outline the tubes. So the tubes are seen as opacified or white color structures on the X-ray. So if the tubes are open, the dye will come through the tubes this fimbrier and freely, and if their tubes are blocked, the dye will fill the tube like a balloon. So that will be blocked tubes. Once the tubes are open, then you can try for natural conception also, or we can do IUI if there is some kind of male factor infertility. So IUI is helpful in those cases where there is male factor infertility, mild to moderate, not severe. That is, the count is more than 6 to 10 millions, and good amount of motility is also there, and with normal morphology. Now, what are the couples where we have to go for IVF? So IVF is not for everybody. IVF is for those patients who are having blocked tubes. HSG पे जिनकी ट्यूब्स दोनों ब्लॉक्ड आ गई हैं, जहाँ ट्यूब्स दे आर रिमूव्ड बिकॉज ऑफ some surgery, maybe previous surgery, like you had ectopic pregnancy, जब ट्यूब में प्रेगनेंसी हो गई थी तो उसकी सर्जरी होगी दोनों तरफ की. मे बी वन ट्यूब इज़ ऑलरेडी रिमूव्ड एंड सेकेंड ट्यूब इज़ ब्लॉक्ड. सो डैमेज्ड ट्यूब्स हों, सर्जिकली हों, डिसीज से हों, जहाँ किसी पेशेंट का ट्यूबोलाइगेशन का ऑपरेशन हुआ है पहले, शी हैड completed her family, she had blocked her tubes because she never wanted to have a next child. For some reason now she needs a child, then she is a candidate for IVF. And other candidates for IVF are who have some ovulation defect, like ovaries produces egg. If there is some ovulation problem like hypo who are never have a normal ovulation, जहाँ जिनको PCOD है, PCOD में भी थर्ड लाइन ऑफ ट्रीटमेंट इज IVF. फर्स्ट लाइन में हम लोग नॉर्मल ओरल ड्रग्स देते हैं, दूसरी लाइन में हम लोग गनेडोट्रोफिन इंजेक्शंस दे के ओवुलेशन कराने की कोशिश करते हैं, एंड थर्ड लाइन ऑफ ट्रीटमेंट इज IVF. और who are having severe male factor infertility. Male infertility is on the rise. If the male factor is severely depleted, the sperm count is less than 5 million and even 2 million also, and morphology is really bad, बहुत little amount of small amount of normal sperms are there, then they can be a candidate for IVF. Then one problem is their endometriosis. Endometriosis is a problem in which the normal endometrium of the uterus, which is a normal place for the endometrium, is uterine cavity. If it is present outside the uterus, it will cause adhesions. So grade 3, grade 4 patients of endometriosis are there also for IVF. And then IVF is indicated in those patients, in the couple if there is any genetic problem in the family. So PGDA is a technique in which the embryo can be tested whether the embryo is having that particular type of the genetic problem or not. So if it is free from the genetic problem, that embryo can be implanted, that embryo can be transferred inside the uterine cavity. And if the patient is having premature ovarian failure, there are no follicles left inside the ovary, and once the AMH count is less than 1 or critical is less than 0.8 or 0.6, sometimes we see in the patients, those patients, of course the chances of pregnancy are less. The risk of miscarriage and risk of chromosomal aneuploidy also increases in those patients. So where when the follicular count is depleting or an interfollicular count is depleting, AMH is falling on those patients, we can save the eggs, how many eggs are left inside the uterus, by doing IVF. We are stimulating the ovaries, taking out the eggs, then fertilization done inside the laboratory, that is IVF lab. So that is also an indication for doing IVF. And nowadays, because woman is becoming more or more career oriented, she does not want to have baby at the earliest age, then she can preserve her eggs. That is called social freezing. At the right age, at the age of around less than 35 years age, if she can preserve her eggs, or if she is already married, then they can save their embryos. We can freeze the embryos and keep them for the time when the couple wants to become pregnant. So that is the way we can do social freezing also. I have explained, I think I've touched each topic, how you come to the doctor and doctor will advise apart from your history examination, your day to day problems, what are you facing with it, and then where we do IUI, where we do IVF. If you have any problem or if you have any question, you can ask me, you can put in the comment section. I'll be more than happy to answer all your queries. Thank you so much. Thank you so much. Thank you, viewers. There's no question. Thank you so much. Thank you for participating and thank you for